Hi there. My name is Kim Hofmann, and I'm talking about the importance of reducing the risk of childhood obesity. Childhood obesity is reaching epidemic levels in the world. If we look at some of the South African statistics, about 13% of our children under the age of 5 are overweight. In this category, boys are a little bit more overweight than girls, 15% versus 11%, and we don't see any significant difference between the urban and rural areas. However, overweight and obesity rates are significantly higher among older children. Data from the most recent National Income Dynamics study done in 2017, so that's before COVID hit, show overweight and obesity rates of the following. 16% of children aged 5 to 9 are overweight or obese. 22% of children aged 10 to 14 are overweight or obese, and 18% of children 15 to 17 years are overweight or obese. And in this category, girls are far more higher in their obesity and overweight rates than boys. They have a 22% rate versus boys who have a 15%. And we start seeing differences in the urban and rural areas, where the urban areas have about 20% overweight and obesity, and the rural areas about 16%. These statistics are problematic, as overweight and obesity in children are known to have significant impact on both the physical and the psychological health of children. In this talk, I will be looking at some of the negative consequences or effects of overweight and obesity in children. Let's start with the definition of childhood obesity. Obesity can be defined as an excess of body fat. There's no real consensus on the cutoff for the definition of overweight and obesity in children, but a good way to look at it is when you look at the growth charts for children. Overweight is if they're between the 85th and the 95th centile, and obesity is if they are greater than the 95th centile. So let's look at the first effect of overweight and obesity in children, and that is that there is a poorer health in childhood. One of the main effects of obesity in adulthood is the increased risk of chronic diseases of lifestyle during their life, including cardiovascular disease, diabetes, hypertension, some cancers, osteoarthritis, and even non-alcoholic fatty liver disease. These illnesses are a major risk factor for the world's leading cause of poor health and early death. And one of the problems that we are seeing with overweight and obesity in children is that we are seeing earlier onset of these diseases in children. A decade ago, hardly any children had these diseases. Let's look at type 2 diabetes. This is a chronic condition that affects the way your child's body uses sugar or glucose. And obesity, as well as a sedentary lifestyle, have an increased risk of type 2 diabetes. We get high cholesterol and high blood pressure, and a poor diet can cause your child to develop one or both of these conditions. And these factors contribute to the buildup of plaque in the arteries, and that causes the arteries to narrow and harden, possibly leading to a heart attack or stroke later in life. Then we get the non-alcoholic fatty liver disease, and this disorder, which usually has no symptoms, so you wouldn't know that you had it, causes fatty deposits to build up in the liver, and this can lead to scarring or damage of the liver. And then the liver can't perform its functions anymore, detox, digesting fatty acids. Joint pain is another problem. Excess weight can cause extra stress on the hips and knees, and childhood obesity can cause pain and sometimes even injury in hips, knees, and back. And then we've also got breathing problems that can occur. Asthma we've seen far more commonly in children who are overweight, and these children are also far more likely to develop obstructive sleep apnea, which is a potentially serious disorder in which the child's breathing repeatedly stops and starts during sleep. The second effect of overweight and obesity in children is a lowered self-esteem. Obese teens have a considerably lower self-esteem than non-obese teens. And this difference in self-confidence is most prevalent around the age of 14, because this is a crucial time where teens develop their sense of self-worth. Studies have shown that obese children have significantly lower perceived sports ability, physical appearance, social appearance, and overall self-worth than normal weight children. And this is seen far more commonly in obese girls than in obese boys. Teens with a low self-esteem often feel lonely, they feel nervous, and they're generally sad. Studies have shown greater rates of depression, anxiety, poor body image, and social isolation in children with obesity. They also are more inclined to experiment with cigarettes or alcohol or drugs as coping mechanisms, and then also to try and fit in. And withdrawal from social activities and family is also very common. The third effect of overweight and obesity in children is a higher likelihood of being bullied. Many children experience daily teasing, taunting, bullying, or rejection because of their size. And studies have shown that the amount of abuse a child receives is directly linked to their weight. This can result in depression and isolation all on its own. And unfortunately, overweight and obese children are a particularly easy target. Firstly, because as a society, we are extremely body conscious and we tend to disapprove of obesity. And secondly, because bullies will always target those with vulnerabilities. And if someone has a low self-worth, of course, they are an easy target. The relationship between obesity and bullying is complex. We get the one side where overweight and obese children are targeted more for abuse at school. And then we get the other side where they can become the ones who engage in the bullying. This is often a direct result of being bullied themselves. And then lastly, bullying can also contribute to obesity because food becomes a comfort, a distraction from the abuse that they are suffering. The fourth effect of overweight and obesity in children is a poorer school attendance and poorer school achievement. The association between obesity and poor academic performance has been well established in many studies. In one study, it was shown that healthy weight children were 13% more likely to report good performance at school than children with obesity. Obesity and educational outcomes are mediated by a couple of factors. We get the biological ones, which if they are ill, they have to skip school more often. The behavioral ones, where if they don't take part in physical activities because they're too shy to. And lastly, the emotional and mental ones, like low self-esteem or poor social connection. And these can all lead to lower class participation and result in reduced educational performance. The fifth effect of overweight and obesity in children is poorer health in adulthood. Childhood obesity is associated with an increased risk for these diseases, not only during the childhood, but also later in life. Even more concerning is that there's an independent increased risk for cardiometabolic syndrome and resultant cardiovascular risk in adulthood. And this is likely due to the fact that obesity is accelerating that atherosclerosis or plaque buildup that is already happening in children. So by the time they get to adults, how thin and narrow and brittle are their arteries. These diseases can cause lifelong physical and mental problems. We know that adult obesity is associated with a higher risk of type 2 diabetes, heart disease, and many of the cancers. And we are just adding to the adult problem when the body's health is already starting to deteriorate in childhood. So in conclusion, the negative consequences of obesity are serious, and this is why we need to reduce the risk of childhood obesity. There's a large amount of evidence showing that childhood obesity leads to adult obesity. And we know that obesity is difficult to treat, which is why we need to work on prevention of obesity in children. Preventing obesity has a direct benefit for the child's health and well-being during their childhood, and then also continuing into adulthood. Thank you very much.